Hello, everyone. Thank you for coming today. I'm Joana Osório, and I lead a project called Open Pharma. Open Pharma aims to drive a positive change in the way pharma research is communicated. We are a forum of industry leaders, so we are run by Oxford PharmaGenesis, which is a company I work for. It's a consultancy company in the area of the healthcare communications. And we now have 17 pharma companies and 2 publishers as part of Open Pharma. The publishers are Taylor & Francis and Sage Publishing. We have 4 main focus areas. We aim to drive transparency by focusing on things such as open access and data sharing. We want to increase accountability, and we work with persistence identifiers, encouraging their use. We work, for example, with ORCID. We aim to make pharma research more accessible, and we've done some work on plain language summaries, for example, and we would like the research to be more discoverable, and for that, we encouraged better use of metadata, for example. And now I'm going to talk about 3 examples of projects we've done to give a bit of a flavor of our activities. One of them is an open access benchmarking tool, which we did in collaboration with the Lens, and this is available freely on our website. The problem here was that there are, of course, many funders with mandates that promote open access. 3 pharma companies, to our knowledge, also have those mandates, and more pharma companies don't have mandates, but they have high targets for publishing the majority of their research open access. Yet there are some journals that don't offer the same open access options to pharma authors and academic authors. To try to understand the potential bias and the potential consequences of it, we developed this dashboard to track open access patterns in different research settings. And we have presented these results at conferences, and we also have a preprint, which is on bioRxiv, about our dashboard and the first results. Another thing we did was to publish a standard for best practice, what we believe is best practice for plain language summaries. These are, in our opinion, must be, of course, short, concise, written in an accessible language, published with the paper, non-promotional, just about the research, indexed, peer-reviewed, and of course, open access. The third example I wanted to talk to you about is our data sharing survey. So we try to understand the problems people were having in submitting data associated with publications. We run this needs assessment survey that showed that many pharma authors have challenges complying with journal data sharing policies. And this project sparked a project from the STM Open Research Committee that is now looking to improve the guidance for authors specifically about medical data at journals, and also developing a checklist that will hopefully help publishers to be more consistent in the implementation of this best practice. This is just a little flavor of some of the things we do, but if you want to know more, please talk to me and reach out to us. We have a website, we have a newsletter, and also our social channels. And we are a very collaborative group, so that's why I'm here. And any questions, you can talk to me later. And thank you very much for listening, and hope you enjoy the conference.